The Health Minister, Dr. Joe Phaahla, has urged the public not to panic over the outbreak of mumps in the country. The National Institute of Communicable Diseases confirmed the outbreak after a sharp increase in positive mumps cases that were recorded in 3 provinces. Most of the positive cases were in children between the ages of 4 and 9. Phaahla says government is working on increasing immunization to tackle the outbreak. He was speaking at the main Nurses' Day celebration at Pulosong Hospital in Tsakani, Ekurhuleni. We're joined now by Nevashan Govender, Acting Head Outbreak Response Unit at the National Institute for Communicable Diseases. A very good evening to you. Thank you so much for speaking to us. Now, how do you determine what an outbreak is? What is the median positivity rate required to say this is now officially an outbreak?
Thanks for having me. So the definition of an outbreak is really in the absence of threshold or formal surveillance, as is the case for mumps. Mumps is not a notifiable medical condition, and so there is no surveillance, formal surveillance platform for it. And so with mumps, we had to use available data to determine a trend over a number of years, and so we went back all the way to 2013 to date, and we determined that there had been an unexpected increase in the number of test positives for mumps in a very short period of time, and that constituted an outbreak. So an outbreak really is an unexpected increase over a very short period of time.
So when I was reading the introduction earlier on, I was speaking about the ages that have shown a higher incidence rate. I was quite intrigued because I was diagnosed with mumps I think a couple of weeks ago. I was somewhat surprised myself because obviously we believe that we've been immunized against it from a very young age. So tell me a little bit more, is it more particularly younger children, and how does it, get to the level of adults, the transmission level as well?
So mumps usually affects, as you said, younger children, mostly under the ages of 10. Highest numbers usually in the ages 5 to 9. However, what we have anticipated, as we've seen with other vaccine-preventable diseases such as measles and the ongoing outbreak, there's an immunity gap that now exists as a result of the impact that COVID-19 had on uptake of routine vaccine. The MMR vaccine, which is available in the private sector, is not routinely or universally available across the country. It's actually not part of the expanded program for immunization. It's not on the, it's not one of the vaccines. And so as an adult, if you have not been previously exposed to mumps, there is the opportunity for you to then, come down with the disease. Once you have the disease or you have been immunized, you should have lifelong immunity. On the very rare occasion, you may have a second episode.
Okay, so it's interesting to hear you talk about COVID-19, because the thought that I had when I was told how I contracted it, or, how you do end up contracting it, I just thought to myself, it sounds to me like COVID-19 non-medical interventions should really be a standard everyday practice that we get used to, especially in terms of the washing of hands and sanitation. And I'd like to hear your thoughts about it and how we are also regarding COVID-19 now, even though we're told it's not a health emergency. Are we still studying the current infection rate? Are we tracking provinces that have high levels of it and warning people to still keep safe?
Yes, so universal precautions, hand washing, your really general good hygiene, are really, that's your first line of defense. And so why it's really important to teach young children, especially for outbreaks like this, that's a really nice way of them protecting themselves. Mumps is the route of transmission is through saliva or from contaminated surfaces. So hand hygiene and having really good universal precautions is the way to go. In terms of COVID-19, yes, it's no longer a public health emergency of international concern. And we saw a rapid, decrease in case numbers in South Africa towards from last year. However, COVID-19 continues to be a notifiable medical condition. We have very good surveillance in place for COVID-19. We will continue to monitor the trends, look out for any new variants, and do our best to keep the public safe.
Nevashan Govender is acting head of Outbreak Response Unit at the National Institute for Communicable Diseases. So as you heard him say, please do keep your surfaces clean, washing your hands as often as you can. And funnily enough, I am an obsessive hand washer and sanitizer. And, well, there you go. I still got it. So please be vigilant.